I'm Ashley Hendrix. I'm a breast surgical oncologist at Regional One Health. Breast cancer is actually the most common cancer in women. It's not the most common killer of women, but it is our most common cancer. Fortunately, with our changes in treatment, that's actually gotten better. The women that are at greatest risk for breast cancer are women who have a strong family history, who've been exposed to hormones. Our African American women have a stronger risk of getting triple negative breast cancer. So a risk assessment is actually a great opportunity for a woman to assess what is my actual risk. So it takes into fact our modifiable risk factors as well as our non-modifiable risk factors. With a provider, the patient goes through her history of GYN, her family history, some personal risk factors as far as things she may have been exposed to, some history with her breast, and then we can create actually a calculating score. There's some large national databases that allow us to give us relative risk. It may not be an absolute risk, but gives us an idea about, in comparison to population, how at risk are they. It's really important to know the risks so that women stay aware. It's important so that they know the changes in their breast and they know when to seek help. The most important thing is to be aware and to recognize changes such that we can find things at the earliest possible stage. Mammograms help us to find the things that people can't feel. And so the things that you can't feel, as a normal everyday layperson, we say the thing that you can feel is about the size of a walnut, which is actually pretty large. Mammograms help us to find the things that you can't feel, so things that are smaller than that. It also helps us to find the things that perhaps don't create a lump, but in fact just change with some calcifications on your mammogram. It allows us to treat things as early as possible. Most important thing when you've been diagnosed is to find a team that you feel comfortable with. That team is somebody who's going to walk you through and tell you what to expect, the options that are yours, as well as to help you emotionally decide what's going to be best for you and your family. My team is myself. I have a nurse that has a very long history of oncology who helps to provide another wonderful support system, a medical assistant, as well as a set of genetic providers that help us with testing to determine, can we identify how you got this, and are you at risk for any additional cancers going forward, which also helps us to help your family. If breast cancer is caught at the non-invasive stage, then you don't need a lot of the systemic therapies that you think about. There'd be no chemotherapy as an option. You may only need surgery and radiation, or just surgery. In women who have very small tumors, even those women sometimes don't need chemotherapy. So as early as you can catch it, you may not need as much therapy as somebody else to help treat it and prevent it from coming back. Surgery is a big deal regardless, and it can be scary for a lot of people who've never had it before. I think the most important thing to tell women is that we're here to help you get through it. There are a lot of things that we do now that we weren't doing 5 years ago that helps with postoperative pain control that I think helps to relieve some of those fears, is that afterwards women realize it's not quite as hard as I thought it was going to be. It's also important to know that all surgery has risk, and we're here to help mitigate that as much as possible. Help you walk you through it and make sure that nothing bad happens to you. So genetic counseling is that piece we talked about as part of our non-modifiable risk. And so we start to look to see who in our families had cancer and what types of cancers. What we know is that there are some genes that, when you're born broken, put you at risk for getting breast cancer, but also other cancers. And so that helps us to determine, are you being screened for everything you should be screened for? What's my risk of getting a second cancer? And also, there are several specific mutations that have specific therapies that are recommended that actually have better outcomes. It also helps us in that whole emotional piece of going, can I give myself a reason as to why? Or is it just because I was born with ovaries? The other piece of that is, what can I do for my family? I think a lot of women really worry about their family and how they respond to the diagnosis, but also, am I putting my kids at risk? Are my kids at risk? And that allows us to give them an answer. Most important thing I think I like to tell everybody is I see most of my patients for their lifetime. And when I say it's really important for me to make sure that in 5 years when we're having this conversation, that you're comfortable with the decision that you made today. Because what I want most people to know is if caught early, most patients are around talking to me at 5, 10, and 15 years. Breast cancer treatment has changed dramatically in the last couple of decades to really allow some really great things for people, and it's not as hard as it used to be. I'm not going to pretend it's hard. It's not hard at all, because it is still hard. But what I want everyone to know is there's a lot more hope. And breast cancer, while it be the most common, is not the one that women die from the most.